Support for this program is provided by the following.
Joining us from Southern California, someone who goes to the same clinic at University of California, San Diego that I do, is Maggie Buckenmayer. Maggie, you are still in the watch and wait phase. When were you diagnosed?
I was diagnosed on November 1st, 2018, and my diagnosis happened from just a routine annual blood check. And they noticed that my lymphocyte counts were high.
Okay. And when you were told, maybe even kind of as an offhand remark, that it could be leukemia, that was a heavy blow for you, wasn't it?
Oh, it was extremely tough. My husband and I were actually traveling, and I got a call from my internist, and she started to talk about my blood results and said, you have some strange blood results. It may just be an infection, or it may be, you may have cancer. And it may be leukemia, just right there on the phone. And I've never felt better. I exercise a lot. I eat a healthy diet, just very, very positive place in my life. And that hit me like a ton of bricks, because I never, ever, imagined that I would have leukemia. And when you hear the leukemia word, it's pretty tough it was pretty tough for me to wrap my head around. So I went into kind of a tailspin for a while there.
And my understanding is you met up with your twin sister, and
right.
You were wondering whether you were going to tell anybody, and then it just came out.
Right. Yeah. And actually, it was during that trip, and I had told my husband, I said, I'm not going to tell anyone. This is just between you and me. Let's do more tests, find out exactly what's going on. Because at that point, they didn't know if it was leukemia or lymphoma or what was happening. And I saw my twin sister, who I'm extremely close to. Just one look at her, and I burst out crying, and I just went running up to her, and I said, I get upset still, but I said, I've got blood cancer. And, she just gave me the biggest hug. And luckily, she's a therapist, and she was great. And, I can't thank enough my family and my support system. And, today I've learned a lot more about the disease. I'm, like you said, at UCSD Moore's Cancer Center. I have a fabulous doctor there. And a lot of that has been, my anxiety and tension has really calmed down. And, I feel like I'm on a great path. I feel healthy. I feel great. And when it comes to time that I need treatment, I think I've got a really good positive headset now. But that first month was awfully really bad.
What if it gets to the point where your physician here in San Diego says, this has changed, your white blood count is changing, you're developing various symptoms, we can get lymph nodes and night sweats and things like that, and it'll be time for treatment. Are you prepared for that?
I think mentally and emotionally, I'm fairly prepared for that. I've also tried to be as involved as I can in other, the Leukemia and Lymphoma Society and the CLL Society, and listen to a lot of podcasts from a lot of CLL experts. And I have such great faith and hope in what's happening in trials and current treatments that I know that at some point my prognostic factors are probably 5 years. And I'm doing everything I can, similar to Jay, and trying to stay healthy and eat a healthy diet. But when it comes to that point in time, yes, I'll raise my hand for a trial or go on the most current medication.